Hello, this is Dr. Grant Cooper from Princeton Spine and Joint Center. This video is going to tell you everything you need to know about neck pain in just under 17 minutes. We're really going to get into everything, so if you or someone you love has neck pain, then this is going to be the video for you. All right, we have a lot to cover, so let's get started. First off, as with lower back pain, we need to think of neck pain as two different basic types. There's acute and there's chronic neck pain. Acute neck pain is neck pain that lasts for less than 6 weeks. Subacute and chronic neck pain lasts for longer than that. Now, this distinction is so important to make at the outset because we understand them very differently. For chronic neck pain, we know there are two main causes that together account for about 90% of all chronic neck pain, and we'll return to that in just a moment. With acute neck pain, our understanding is a lot different because for one, there are many potential causes. For another, because it goes away within a few days to a few weeks, research on acute neck pain is a lot harder to do, and there's a lot less of it. That said, the most common cause of acute neck pain is a muscle strain or spasm or a ligament strain. For all of neck pain, proper posture plays a pivotal role. You may have heard that our heads weigh a little more than a bowling ball. And if you hadn't heard that, then, well, now you have. Carrying a bowling ball directly above your neck or shoulder all day is hard enough. But carrying it out in front of your neck or shoulder is much, much harder because there's much more torque, right? There's a lot more force being placed through your neck. Many of us, probably most, walk around with our bowling balls in front of our necks. We call this anterior carry, and it's part of poor posture. Poor posture places a repetitive strain on the muscles around your neck, and that can easily lead to muscle and ligament strains and sprains. There are a few neck stretches and postural exercises that are great at fixing acute neck pain and addressing poor posture. For more of those particular exercises, you can check out our video on acute neck pain exercise fixes. Another very important factor with acute and chronic neck pain is paying attention to our ergonomics with our computers and phones. Now, with your computer, for example, you want it to be in front of you at eye level, so you aren't extending your neck forward. The one simple trick that I'll just tell you now is to take your computer screen and bring it closer to you, closer to your head. This forces you to sit back and straighten up, because if you don't, you come forward, you bump your nose, right? And the screen reminds you that you have to sit back up. Let's go to chronic neck pain. Chronic neck pain is easily one of the best studied musculoskeletal conditions on the planet. As a doctor, I love it when there's plenty of good research to lean on because it means I know what I'm telling you is on solid ground. The most common cause of chronic neck pain is facet joint pain. Now, here's a neck. The facet joints are over here in the back of the spine. They're little mobile joints, just like the other joints in your body, like knees or fingers or hips or shoulders. And just like other joints in your body, they're prone to injury and they're prone to pain. In people with no known injury to the neck, facet joint pain accounts for about 60% of chronic neck pain. In people with a history of whiplash injury, like a motor vehicle accident, but also a history of playing football or wrestling or any other sport with repetitive extension of the neck, or in anyone with a hyperextension injury to the neck, even if it was a long time ago, the facets account for as much as 80% of chronic neck pain. That's a ridiculously large number. So facet joints are a huge cause, and they're very important to understand in regards to neck pain. And the second most common cause of chronic neck pain, but it's a far second, are the intervertebral discs in the spine. And these account for about 20 to 30% of chronic neck pain. When discs cause neck pain, it's not the same as saying a herniated disc in the neck, which might cause arm pain and other symptoms if the disc irritates a nerve, but can also be asymptomatic. Rather, when a disc causes neck pain, it's because there's a tear on the inside of the disc. See, the intervertebral disc is like a jelly donut. So there's the disc, and then it kind of looks like this, with the jelly on the inside that's full of inflammatory proteins called the nucleus pulposus. It's this part that gives the disc its cushioning effect, so the bones aren't rubbing on each other. And then there's the crust of the disc, which is called the annulus fibrosus. Now, the inflammatory proteins in the nucleus pulposus will cause inflammation and pain if they get next to a nerve. Fortunately, there aren't any nerve endings in the jelly of the disc. And if there are no nerves, there's no pain. However, in the outer third of the crust of the disc, in the outer third of the annulus fibrosus, there are nerve fibers. Kind of looks like that, the nerve fibers out there. And in a tear in the disc, it looks like a slice of pie. And the jelly in the disc oozes out and it irritates the nerve fibers in the outer third of the crust of the disc. Now, clinically, neck pain from the facet joints and neck pain from the disc present about the same way. That is, the pain may be in the neck or the suboccipital region at the base of the skull. Often the pain will refer into the head or even into the eye. Very often the pain will refer into the shoulder blade or periscapular region. With both facet and disc pain, there will often be a lot of overlying muscle tightness and spasms. This happens because the muscles are trying to guard in order to protect your body and the spine against the inflammation, so they tighten up. Unfortunately, this natural reaction of the body tends to just create more pain and inflammation in the myofascial region. Fortunately, when you get the underlying cause better, when you get the facet joint, the disc, for example, better, the muscles that were guarding, they aren't triggered anymore and they tend to relax on their own without much further intervention. So, how do you go about diagnosing what is causing your chronic neck pain? We just said that both facet joint and disc pain look the same in terms of how they feel to you. On physical exam, they both also present the same. Now, the best imaging study for the cervical spine is an MRI. But unfortunately, MRIs are very limited, as in the case with lower back pain, because everyone gets some amount of wear and tear and arthritis in their facet joints and disc. And this wear and tear often, indeed usually, doesn't cause any symptoms whatsoever. That's interesting, right? It's surprising. Sometimes the arthritis that you see on the MRI causes symptoms, and sometimes it doesn't. Why is that? Well, the reason why some arthritic facet joints and some arthritic discs cause neck pain and others never will is a function of whether or not the body responds to those degenerative changes with inflammation. It's this inflammation that either is going to cause pain or never will. Now, inflammations are proteins that if they get next to nerves, they cause pain. If there's no inflammation, there's not going to be any pain. It's as simple as that. Now, inflammation is a protein response, but the best way that I've found to think about it in this context is that it's like a fire. And there are two ways that you can put out a fire. One is to move away all the sticks. You move away all the fodder from a fire. You clear it away, and you let the fire die down on its own. In the case of neck pain, this can be surgical, but really what we're talking about are exercises and better posture and better ergonomics. Moving away the fodder from the fire is about training the muscles to better support the spine so the spine can rest and heal. And when it comes to specific exercises, you can check out our video on exercises for chronic neck pain. And one point that's often overlooked with neck exercises, particularly when it comes to chronic neck pain, but also just as a means of preventing neck pain in the future for everyone really, is focusing on the scapular stabilizing muscles and also on the core muscles in the lumbar region. These are so important because by strengthening them in the right way, we're ensuring better posture in addition to stretching the specific neck muscles. Sometimes though, you can clear away all the fodder, but the fire is just going to keep on burning. Or it's also important to mention that sometimes the pain's so bad that you can't really do the exercises in the first place. In those instances, you need to put water on the fire. Now in this instance, the water, the fire hose, is anti-inflammatory medication. That anti-inflammatory medication can be in oral form and could be something like non-steroidal anti-inflammatory medication, either over-the-counter like Advil or Aleve, or it could be prescription strength. Or it can be an anti-inflammatory supplement like turmeric or curcumin or tart cherries or bromelain, for example. However, the limitation of oral anti-inflammatory medications or supplements is that only about 2% of what you take by mouth will reach the spine. So very little of what you're taking orally will actually make it to the site of inflammation. Now the other approach is to use X-ray guidance to perform a targeted injection to the actual source of inflammation. In the case of the facet joint, that would be an intra-articular facet joint injection, similar to if you were doing a knee injection or a hip injection. You can also block the small sensory nerve called the medial branch that innervates the facet joint. In the case of the disc, this would be an epidural steroid injection, which places medication around the disc. Doing an injection into the disc with steroid has been tried, doing an intradiscal injection, but for various reasons it doesn't work. Now, when the anti-inflammatory medication takes away the inflammation, and therefore the pain, it's important to realize that the problem isn't being masked. When the pain improves a week or two after the injection, the problem isn't numbed like if you were in a dentist's office and they were numbing your tooth. Rather, the inflammation that was causing the pain is gone. But it's very important to realize that the mechanical problem that led to the inflammation in the first place hasn't been addressed. And the anti-inflammatory medication's effects will eventually wear off. Typically, if nothing else is done, a steroid injection gives about 3 months of relief. Now that's nice, but we shouldn't be satisfied with 3 months of relief. Therefore, if an injection is used, it should be used as part of a more comprehensive treatment. The injection, if used, becomes really a window of opportunity during which the inflammation and pain is reduced so that you can focus on your exercises in order to prevent the pain from returning as the medication wears off. Now, there are going to be people who get temporary relief from the facet joint injection, but the pain quickly recurs in a few days or weeks. When this happens, a second purely diagnostic injection called a medial branch block can be performed, in which only anesthetic like lidocaine or marcaine is injected along the nerve that innervates the facet joint. If doing this block takes away the pain for a few hours, then the diagnosis of facet joint pain is confirmed. It's sort of like blocking a tooth with anesthetic and then taking a bite of an apple. If you bite the apple and the pain is gone, you blocked the right tooth. You didn't solve anything yet, but at least you know you have the right spot. If you block the tooth and the pain is still there, then you better block a different tooth because you got the wrong one. Once you have the right facet joint confirmed as the source of pain, you can perform a radiofrequency rhizotomy, also called an ablation procedure, which is an outpatient needle procedure that takes about 45 minutes, in which the nerve that innervates the joint is burned using radiofrequency energy, so that basically the joint can't let the body know that it's still inflamed. It's like the phone's ringing, but you cut the ringer so you don't hear it. The good part is that this is a very safe and effective procedure when done right on the right person. The bad part is that it's still invasive, and the nerve does tend to regenerate in about 6 to 18 months, at which point you may have to repeat the procedure. Now, for this reason, ideally, even after rhizotomy is done, the patient will still do their neck exercises to help prevent the pain from returning as the nerve regenerates. In the case of disc pain, if it's not getting better with good conservative care, there's unfortunately no ablation procedure for disc pain yet. The surgical gold standard treatment remains a fusion surgery for discogenic pain. That's it. That's your neck pain tutorial. I think we finished in time. I hope you found it useful. If you have enjoyed it, and if you've learned something, then please remember to like this video, subscribe to the channel, and tell a friend who might also enjoy it, because that's the way that we can spread good health information and achieve good health outcomes together. As always, if you have questions that you'd like me to answer in a future video, or if you have any comments, you can reach me at drcooper@princetonsjc.com, or of course, feel free to leave a comment in the comment section. Thank you very much.